and, they're just as if they were like, temporarily moving there for a few weeks over the next few weeks. Do you think that that would be safe?
Yeah, I mean, we don't make any policies, but based on public health, there was a comment that if you're going skiing, go to your local mountains. And they actually said, if you live in Vancouver, go to Cypress, Grouse, and Seymour. But I think Whistler's in the same health authority as VCH. So if, I think as long as you stick to the restrictions of masking and distancing.
Oh, she said not to go.
Yeah, I just saw here, apparently Dr. Henry said, do not go to
So,
Whistler.
so if Dr.
Which
Henry,
I agree with.
Dr. Henry said specifically not to, then you follow that, right?
Yeah.
So I know there was that comment of just go to your local mountains, but I could see don't go to Whistler. It said just don't cross your health authority. But if she specifically, you see it's changing every day.
Every day.
What the affirmative, what she's actually saying, what to do and not to do. So if she actually said not to do it, then no. But that's not really answering the question of safe or not safe, right? That's just saying follow what public health says. That's basically bottom line. We can't say anything other than that.
But obviously, the less you travel, the less people you're in contact with. Obviously, it's safer. And if you happen to be an asymptomatic transmitter, you make it safer for everybody else. And so, of course, me, as I got a bunch of comments last time on what I wear when I go bicycle riding. Obviously, for me, I'm very much on the safe side. I like what Australia did, and I know it's not that side.
News is saying that it appears that Dr. Henry has been caught off guard by the sudden significant spike in caseload. Based on what appears to be her very, very close monitoring, her dedication in general, what would you suggest were the likely causes of this mass increasing caseload over the last 3 weeks?
I think that when you have gatherings, so the Thanksgiving holiday and were there other holidays? Halloween. And Halloween, all those, Halloween was when it started really going up. Anytime you have gatherings, like we talked about last time, right? If there's 6 people in a room or 8 people in a room, everybody's wearing masks, one person is infected, and you're sitting in a room for 4 hours, and everybody's wearing a regular mask, 4 or 5 people get infected if you're there for 4 hours. And so the conclusions from that study in Colorado say that what's important is the time that you're together, what type of environment you're in, and it's becoming more and more clear that if you're in an environment where there's excellent ventilation, it really reduces your risk. And also what type of face protection you're wearing on, because if you're wearing N95 and you're all in the same room for an hour, the risk is very close to 0. And so I think the more exposures you have, the more high risk exposures, the more family gatherings with more than a small number of people increases risk. So I don't know exactly what Dr. Henry was thinking. I think that she tries to make her best decisions based on the data that's available. And I think that she's doing a good job of communicating what she thinks is best.
One of the questions came in, someone will be having surgery next Friday and needing to be in the hospital for 1 to 2 days, and also having to be at the hospital beforehand for pre-admissions with a nurse and an anesthesiologist, pre-appointment, and so on and so forth. And they want to know how they can best protect themselves while in the hospital.
Well, I mean, a couple of comments about the hospital. I think, I haven't been in BGH in a while, so I'm sure they're doing a great job. But at St. Paul's, I think they're doing an outstanding job. You have to wear a mask, you have to wash your hands. The unit where I work, I think, is extremely safe. I do not feel unsafe there at all. There are areas in the hospital where we have COVID patients. And in those areas, there are specially trained personnel that are experts in putting on PPE and on coaching us and monitoring us and making sure that everybody's safe. And thankfully, we have not had any outbreaks lately at St. Paul's. And we have been so I actually think the hospital is extremely safe.
So, but right. to help the answer the question, because it's a common thing. Partly it's I guess preparing yourself with your own PPE, your own mask and hand wash. When you enter the any hospital, there's going to be hand wash out there, but planning your route like knowing in advance. So my advice would be knowing where you're going. So you minimize mistakes, and going only to the places you're supposed to go. This is considered an essential service. Going shopping, going to doctor's appointment, going to your pre-op, going to the surgery. So it's like you have to do that. So it's like finding the least amount of time to get to where you need to go. And then I would say there is a trust factor when you're in an environment that's not your own. So you have to protect yourself as much as you can, advocate for yourself. So wear a mask. If you see someone around you not wearing a mask, make sure you're distancing. You can ask someone else to put on PPE as well. And when you're in a hospital bed, you can wear a mask yourself. It's not always enforced for patients to wear masks. Everyone coming to you will, but you reduce your risk if you have the capacity from a breathing point to wear point of view to wear a mask while you're in a hospital bed. So that's kind of a choice, but you can make that choice to wear a mask if you're able to from a respiratory point of view.
And actually, I just have, thank you for reminding me, Debs. I just printed out, so this is a very recent study in JAMA also so I thought this was interesting and people would be interested in this. So they looked at older people who were ages, the average age was 76. And they looked to see if there was a change in oxygen. So the people had to wear a little monitor on their fingers that says the oxygenation level. And people had to wear a regular surgical mask. And they looked to see if the oxygen saturation was down, and it wasn't. Because there's a lot of things in the media that masks can be dangerous and you reduce your oxygen, and it doesn't. And so all the more reason to wear a mask. So when I go to see patients, I wear a mask. I wear a mask the entire time from when I leave my car in the hospital until I get to my office, and then I put on surgical clothes and go around and see my patients. But all my patients wear masks. The visitors in the hospital have to wear masks when they're in the room. They're supposed to stay at least 6 feet away from the patient as much as possible. And so, again, I think, like Debbie said, masks are important, and just try to maintain 6 feet. And I think the other thing that I'll emphasize, and this wasn't my idea, it's what Dr. Offit said, was that if he had a choice now between the vaccine and masks and social distancing, obviously the most important thing is social distancing. Social distancing is perfect. The further you are away from somebody, the less likely you are to get it. And if you're outside, it's still extremely low. And I will tell you that I was outside with somebody and I was wearing a mask, and that other person had COVID. That person didn't know. He or she didn't know, and I'm fine. I didn't get COVID, and I monitored, and so I think social distancing and being outside is a very safe pathway.
But you can't do that when you're going for an operation.
No, you can't do it outside. Yeah.
Thank you. So I have a few questions about vaccines. The first being, is there any data so far about vaccinating children and those who are pregnant? And then the next part of that question is it, I had to step out for a minute while you were talking about vaccines earlier, but I don't know if I missed whether you spoke on whether Canada was going to be one of the last places to receive their vaccines, which is what we were hearing a little bit in the news today. So if you could speak on those things, if you have.
Yes, I will talk about the kids and the vaccine because I wrote some notes about that.
Just as Charlie entered.
Well, just as Charlie entered, perfect timing, little C.
Charlie can be the first to help out with the vaccine, right, Charlie?
He doesn't.
Where did I write it? Sorry, everybody.
So, but to speak to your question, you have the same news as us. If in the news it is saying that we may be one of the later countries to receive the vaccine, but I don't have any other data other than what I read in the news.
Yeah, I guess I didn't write it down. Yeah, so I think for kids, the idea is for the vaccine that they're going to wait a little longer to ensure safety. The studies have shown consistently that children, especially under the age of 11, are much less likely to get infected. And if they do, they're much less likely to transmit it. So there's been a few studies like that. The number of cases, as far as I know, I don't know if Eric is on or any of the pediatricians, but the number of cases of children that get severe disease or that syndrome called MIS in BC is extremely, extremely low. And some authors actually even think that it may just be a variant of Kawasaki disease, and there's a certain number of children that get Kawasaki's every year. And so I think, you know, for a vaccine, you are giving it to somebody that's healthy. And so when you give somebody a vaccine, for sure, you don't want to make them worse. And so I really think that that's why safety is so important, because not everybody that doesn't get the vaccine will get sick. And those people that get exposed might get infected, but they may be asymptomatic and may have nothing wrong. So if we're going to give a vaccine, we want to make sure that we don't make those healthy people unwell. And as we know, what happened with SARS-1, the vaccine actually caused potentiation and made it worse. Now, that has not been shown in any of the vaccine trials so far, and there's been no signal. And even the person in the J&J trial that died in Brazil, that was, I don't remember, that was a few weeks ago, and people were very nervous. But it just so happened that the person died was in the placebo group, and he probably died of COVID. And so it was just happened to be, that was the case, but it just turned out that that person did not get the vaccine. But I think the point to emphasize about the vaccines is that a vaccine trial is useful if a bunch of people get sick. And then when you reveal who got the placebo and who got the vaccine, that those that got sick are more likely to be in the placebo group. That's helpful. But if nobody gets sick, like if they did a trial now in Melbourne, that would be useless because nobody's going to get it. Or if they did a trial in Taiwan or New Zealand, that who cares? Because nobody's going to get sick anyway. So you can't say, well, the vaccine worked because nobody got sick. Well, they weren't exposed. So you want to do a vaccine trial like in a place like North Dakota or wherever it's very severe, so that people are really, really exposed, and then they can get a lot of people get sick, and then hopefully people that get sick are in the placebo group. And that's why I told the story about polio in 1955, because I think it was a very similar situation then, and that's how they were able to draw that conclusion that the vaccine was potent, safe, and effective. Good question.
Thank you. So someone brought up a question about being like if they were exposed and exposure, and that it's been a bit frustrating in some workplaces and possibly in the schools where, you know, maybe public health is a few days behind in their ability to catch up on who was exposed and who wasn't, and how to know whether or not you should quarantine and that sort of thing. So the specific example was one person was asking was if a roommate comes home symptomatic and tests positive and goes into quarantine, isolated from his two other roommates, do they start their quarantine from the day this person finds out that they're positive, or from the time that they start either A, feeling symptoms, or B, are tested and then found out to be negative, and that's when their quarantine starts? So I think it's a very exact
scenario. So if you have an exposure that public health deems that you need to isolate, it starts from your day one is now. So it's not
when you're notified.
The day you're notified. Mm-hmm. So it's not necessarily the day the person saw you or got sick. That's what I'm pretty sure. That's what I've seen happen. But it's an exposure to a positive person that requires isolation. If you have an exposure to someone who's been exposed to someone who's positive, you don't have to isolate, you have to monitor and self-monitor. That's the general gist of it, but public health makes all the decisions. So that's what we're told in society and in the healthcare community, as well as the community at large, that if you are exposed to someone who's positive, you start isolating the day you're called, and it's 14 days. And if you have to monitor if you were in the environment, look for symptoms, which we should be doing all the time. If you're wearing proper PPE when you're exposed to someone who's positive, you may not have to isolate, right? So that's a public health decision. So it's an exposure that's without PPE that you would have to do the quarantine. But public health is the one who makes these decisions in the end. So then that's kind of the general rules. But then the question is, what if there's a delay in getting a phone call? So that's just the reality, that there may be a delay in contact tracing. I'll just say anecdotally, if you get a call from someone who has a positive test and tells you were an exposure of mine, you on your own have a responsibility and should call public health and ask what to do on the day that your contact tells you that. Because you're right, there may be a delay in you getting the call from public health.
And I think that's where the system in BC is a little bit stressed, is that it takes a lot of manpower to call people and get in touch with them. And although I think the province hired, I think I could be wrong on this, like more than 1,000 people, it's still tough for them to call everybody because there's so many infections per day. And that's why they really want to try to get that number down, because not only is it going to reduce infections, death, and hospitalizations, but it will reduce the workload of people to do contact tracing. And the faster you do contact tracing, the better it is. I mean, it's useless to call somebody 2 weeks later and say you were exposed, because you would have already it's too late. So contact tracing really works if you call them as soon as possible so that you can change the behavior of the person that was exposed. I mean, this disease is more of a behavioral problem than a medical problem. It's a mathematical behavioral problem. And eventually, if you are too, maybe cavalier is the wrong word, but the more cavalier you are, the more likely you are to be exposed and the more likely you are to get sick. But if you behave and you follow all of the regulations and recommendations, then you're not going to be exposed, and it'll be just easier for public health to get into contact with those that were exposed.
I mean, you reduce your risk of exposure by following public health's recommendations. It doesn't, you could be doing the best job possible, following all COVID safety protocols,
still get sick,
and still get COVID. It is still possible. And we see that many times in society, but also in the hospital, where people who have done everything as per public health's guidance in terms of preventing, and they still test positive. So it's behavior for sure reduces it, but it's not the only thing, right? This is a sneaky virus, a very sneaky virus. But yeah, so that's kind of the answer to exposures. In terms of the roommate specific question, it would be I would think public health would say from the day you find out it's 14 days. That's the general message, but every situation is different and requires public health. On day one, it doesn't really matter. You'll find out. Sometimes they change the amount of time after a certain amount of days, but on day one, expect it to be 14 days from the day you find out.
Okay, perfect. This is very specific. This is actually a question from in regards to the Verkeisha. This individual was wondering, is it possible to still be exposed to the virus wearing proper PPE after the body has been properly sanitized and cleaned? Is it still possible to get, from hair or?
I don't know the answer. It's a really good question.
I don't know.
Okay. I'm gonna just jump in here for a minute. There was a question that was sent to me by text. The following scenario. This took place in Toronto, as I understand it, where they also have I believe they have an indoor mask policy. I don't know whether it's an order, whether exactly how that works, or what level of offense it is not to comply. But the expectation is, from a legal perspective, to wear a mask. So someone walked into a Metro, which I guess is their equivalent of Safeway or Loblaws, and they walked into a Metro without a mask. A number of people confronted this person and said, you have to put your mask on. He refused to, was somewhat belligerent, and was also, by the way, wearing the garb of an Orthodox Jew. Of course, in the age of social media, somebody took his picture and put it up on Facebook. And then, if I understand the story correctly, a bit of a comment storm ensued. People said, okay, we're going to we're going to turn you into the police. And apparently in his apartment building, he's sort of carrying on in the same behavior. He believes that there's no efficacy to the masks, or that there's no need for this level of precaution, and he's very belligerent. So the question was, that was put to me, in that situation where someone is obviously scoffing at the health rules in a way where they are likely to put someone else in danger. So I would say, not like you decided to drive from Vancouver to Whistler. I think that's a larger policy question, but I don't know if you're actively putting someone in danger. But possibly walking around indoors without a mask, you don't know if you are a carrier or not at the moment. That's what makes this disease particularly dangerous. And so the question is, would a Jew be allowed to turn in another Jew in that situation? Well, I would say, first of all, there are a number of Jewish legal questions that would have to be determined. First of all, there is a scenario where if we knew that this person was a ticking bomb, and then there is a concept called the rodef, which is the ability to assert self-defense. Even a third party is allowed to assert self-defense. So if this person is a weaponized human, someone who's infectious without a mask would be a weaponized human, then for sure you're allowed to turn the person in. What happens if it goes down a level, right? You don't know if this person is weaponized. That's really where we all are. That's why we're all wearing masks when we go into Safeway and to Superstore, because it is possible that each and every one of us has contracted the disease and we just don't know it. So we're wearing that mask, A, to protect ourselves from the people out there who might have the disease, and B, in case we unknowingly have the disease. It would be less clear to me that you would be allowed to turn someone in that scenario where we're not 100% sure that they're really dangerous. What I would say, though, is that every effort should be made pressuring this person's family, this person's rabbi, to speak to him, to help him understand, okay, fine, you believe the virus is a hoax, you believe that the masks are not effective, but you have to at least give some credence to the fact that other people do, and we're all trying to solve this together, and the mask is the cheapest, least offensive way to do this. So I do think that there's an obligation to intervene. I'm not sure that you are obligated to go call the police to show up this gentleman's door and say you were at Metro at 7:30 p.m. tonight and you weren't wearing a mask. So I guess that is a long way of answering that particular question. So I guess once again, to summarize, I think we have an obligation as Jews to try and ensure that everyone is acting as safely as possible. But I'm not sure it rises to the level of threat that would require us to go and get the police.
Thank you. I have one last question that came in, Rabbi.
Okay.
With all the reports of employees testing positive at grocery stores and pharmacies, is it safe to get groceries in person, or should we be ordering in as much as possible?
Yeah, that's a good question. I like to go to the grocery store. I love going to the grocery store. But I'm very safe. I wear a mask and I wash my hands and I stay away from people. And I do my own checkout on the computerized thing. But I like to choose the tomatoes myself and the cucumbers. But of course, it's safer to order it if you can. I think that's a personal choice. Risk-benefit analysis is that we would say I like going to the grocery store, so I go. But I don't do much else. I don't go to. I have not gone to any restaurants. I have certainly not gone to a gym, and I think that was a really important thing that they closed. And I know and I appreciate that it's very hard for those businesses, and I think that they should be supported. But obviously, if people are exercising and breathing hard and they happen to be asymptomatic, then obviously that's a high risk exposure. And the other thing that the rabbi also said, which I should emphasize, and we talked about it last time, is that the day that you're most infectious is the day before you have any symptoms. So that's why it's really, really risky.
So grocery shopping is considered essential service, just like going to doctor's appointments, going to the pharmacy. So if you have the option, as Gail said, to have someone shop for you, But a lot of people are shopping for other people, right? So it's about risk tolerance. As Gil said last week, last time you could stay home and not go out and not have any exposures, not see anyone, or you can add to that risk by doing different things, and everyone has to do what they're comfortable with. Overall, given the risk benefits, I think shopping is it definitely has lots of benefits. So.
And so does school. That's why
school has lots of benefits. Yeah.
So we're both very supportive of schooling as highest priority.
Gil, we're starting to see outbreaks in various school scenarios. Do you have anything to say about the level of risk of transmission from students to adults? I know there have been different comparative studies. I think Sweden or somewhere in the Netherlands, or in the Baltics versus Israel. I know there was some evidence there, and any thoughts on that?
Yeah, just one thing. I think there's a couple people that by accident unmuted, so it just creates a background noise. But I think that I'm not surprised at all that there's some school exposures. That's normal. But again, like we talked about last time, I think that that's a risk worth taking. I think that education is so fundamental to the advancements of society that I'm willing to shoulder that risk. And so that's why I strongly support keeping the schools open. And that would be the last thing that I would want to close down. But I'm not surprised that there have been a few exposures at school. I think that from the schools that we happen to get direct communications from, I think they're doing an outstanding job of communicating with the families promptly and getting good scientific information and following public health advice. And I think I have only positive feedback to give to the schools that communicate with us.
Okay, interesting. Anna Wallach writes, Anna, who is herself a GP, a family doctor, she says, I can add a comment, school exposure does not necessarily mean transmission will occur.
For sure. Yeah.
A lot of the school exposures that have been happening in British Columbia are not transmission from the school, but maybe from community. And a school is a public place that public health is very quick to contact trace. So the response time is really good in the schools. And so it doesn't necessarily mean that there's going to be significant transmission in the school. But the key is to follow public health guidance. So if you have to isolate after an exposure, following those guidelines, just like if you got any call from public health during this time. So it doesn't necessarily mean there's going to be transmissions throughout the schools and throughout cohorts in the school.
And I think also, like, one of the worrisome is that Canada has scored extremely poorly on. There was a great article, I don't remember which journal it was in now, but that basically for long-term care, Canada is one of the worst in first world countries in that, and I know that in BC, there's been some exposures where there's just not enough. I mean, I'm not an expert in this at all, but it appears that there's just not enough funding even for the cleaning crews. Sometimes the cleaning crews are working in other jobs, whether it be in restaurants or grocery stores. And so that puts the most vulnerable and elderly patient population in our society at the highest risk. So I think that as a community and as a society, we could do better to make sure long-term care facilities are highly protected and follow the role models of other countries like in Scandinavia, where they put tons of funding into long-term care facilities and they're modern and with modern ventilation. And I think that that's something that we could do better going forward once we get control of the virus, because I think that's really a shame that a lot of the deaths in Canada, and I'm sure you've all seen in Winnipeg lately, that those people in long-term care are having a really tough time, and also that their relatives can't visit is really devastating.
Gil, can you, you mentioned it, I think, a little bit earlier, but somebody asked the question, the Great Barrington Declaration, What's your opinion of that? And maybe you explain what it is and share us what you think about it.
Yeah, so my opinion is I totally agree with Dr. Fauci and Dr. Offit. I think it's the principle was that in the United States they didn't want to lock down and they want to protect a vulnerable population. Well, obviously that's the case. Nobody disagrees with that. Obviously, nobody wants a lockdown and everybody wants to protect the vulnerable people. And the idea was that if you just let the virus run rampant, you're going to get herd immunity. But that will not happen, as we talked about at the beginning. Measles, like we said, is 10 times more contagious than COVID. And for measles prior to the vaccine, there was still 2 million people that got it and 500 deaths a year. And there's never been any virus in the history of the world that has created natural immunity where it just peters out. And so, yes, the Barrington Declaration, the goals are very admirable to try to keep businesses open and to try to protect the vulnerable. But the pathway of doing it and following the Swedish example doesn't make any scientific sense. And so I strongly agree with Dr. Offit and Fauci and Bachner, all the leading scientists in the States that have written about that.
Okay.
Yeah, that's the point. Debbie's actually, that's the punchline, is that if you let everybody get exposed, yes, everybody eventually will get infected, but your price to pay for that is many, many, many thousands of unnecessary deaths. Thousands of unnecessary deaths.
Hundreds of thousands.
Yeah, hundreds of thousands. So obviously that's a bad idea. The economy will repair itself once people are healthy. The reason why people like myself aren't going to restaurants is not because we don't want to go to restaurants, it's because we want to try to protect the community and limit exposure. But obviously if we were in Melbourne, I would be going to restaurants also. And so obviously as people get healthier and the virus goes away, business will resume. So I think it's better for business, better for society, better for mental health, better for physical health, better for education, if we get the virus under control and get the numbers as close to zero as possible.
Well, thank you, Gil and Debbie, once again. Very informative, helping us to really get on top of this. I'm going to take the last couple minutes just to, I'm going to share my screen and let everyone know that about this program where we're having a special memorial for the Shloshim of Rabbi Jonathan Sachs. It's going to be Sunday, December 6th, 10 to 11 a.m. Our time. The reason it has to be at that time is because that is otherwise it's just impossibly late in the day for the English presenters. And you can see it's Chief Rabbi Ephraim Mervis and other individuals who were very close confidants of Rabbi Sachs, and really kudos to Rabbi Shlomi Gabay, who was able to secure this for our community. I'm sure a lot of people were not able to get the Zoom ID from seeing the poster, although I'm sure you got it from either Beit HaMidrash or Shara Tzedek, but I just put the Zoom ID into the chat so you can copy it down now. That's again December the 6th at 10 a.m. Is our opportunity for that. And really, one of the things that we're seeing is there's really been a tremendous changing of the guard in the Torah world between Rabbi David Feinstein, Rabbi Adin Steinsaltz, of course, Rabbi Sachs, we just mentioned, Rabbi Nachum Rabinovich, who was actually Rabbi Sachs's rabbi. He was the person that Rabbi Sachs would go to when he couldn't answer the question. Rabbi Nachum Rabinovich also passed away within the last couple of months. So it's really been a very tumultuous time in the Torah world as well. Once again, I want to thank everyone for joining us. It really is. I have to agree with Gil. It is fantastic to be able to see everybody's faces on this. I'll tell you that for me, this is even better than the Jewish history, because when I do Jewish history, I'm so intensely focused on the presentation that it's much harder to see all the faces. But this is great because I get to see all the faces who are here. By the way, special shout out to Russ Klein, who is leading a school in the middle of some very challenging times and doing a fantastic job. So thank you to Russ. Gil didn't mention him by name, but he almost did. And I just want to also thank Howie Kolner. Howie Kolner is served his last board meeting at the Sharet Tzedek as president just 2 nights. I think it's 2 nights ago. I'm losing track of time. Howie has been really a wonderful president, and if you don't know how hard Howie has worked for the synagogue, I don't know whether I have the words to express it, but he's been a wonderful leader, a passionate leader, and really a tremendous asset to the shul. And really, we would not have made it through this time as well as we did without Howie's leadership. So thank you to Howie, and wish everybody a Shabbat Shalom. And
maybe I'll just say one thing, Rabbi, because I want to thank you and Kimel for doing such a great job in organizing this from the beginning, and for having your wisdom and idea to get us all together and to keep us reading and on top of it. And I think that knowledge translation is such an important part of our community and is really important. And I appreciate that everybody's doing their part to keep everybody safe, and also that the rabbi and Howie and Kimel and their whole team has done such an outstanding job at the synagogue to keep services going as best and as safely as possible. So really kudos to our team at the shul for doing a really outstanding job.
Well, I appreciate that. You know, I saw someone, one of the rabbis I follow on Twitter said, a rabbi is only as good as his network. So I think that's really true. The rabbi is only as good as his network, and I feel I have an amazing network, of which Gil and Debbie, Howie, Russ, and many, many, many others are all part of that network. So it's good to see the network show up in such numbers tonight, and everyone have a great Shabbat.
Shabbat shalom.
Shabbat shalom. Thanks, everyone.
Shabbat shalom. Thank you.